I hope you listened to the Dealing with Angry Patient lecture. I uploaded it on the Facebook, on the YouTube channel, because today we are going to deal with angry patient actually.
Actually, not yet, but.
طيب, anyhow, I'm going to take it.
Okay.
But let's start إن شاء الله. Who is going to take the first case? طيب,
Me, Dr. Mona. دكتور منى.
ايوه,
انا منى.
دكتوره منى, ازيك؟
ازيك عامله ايه؟
الحمد لله.
Okay, can I take the first case?
You listen to the lecture?
Yes, I did.
Perfect. Okay. I'm going to share the screen with you.
Okay.
This is the first case. Please talk to Mrs. Layla. She's the wife. Her husband, Mr. Mahmoud, was admitted with ischemic stroke, for which he received thrombolytic therapy.
Okay.
Then his consciousness rapidly deteriorated. Urgent brain CT revealed massive brain hemorrhage. His Glasgow coma scale is 7 now. Neurosurgeon decided not for intervention. Your task to discuss with his wife, who is angry, as she has been told about the good outcome of thrombolysis. He had assigned DNR.
Okay.
Okay. I'll give you 2 minutes to think about the scenario and arrange your thoughts.
Okay. Okay, I'm ready. Can we start?
Okay. Yes.
Okay. Hello, good evening. I'm Dr. Minna Mahmoud, one of the doctors working here today. Nice to meet you.
Pleased to meet you, doctor.
Are you Miss Layla, wife of Mr. Mahmoud?
Yes.
Okay, nice to meet you, Miss Layla.
Yes,
today we are here to discuss your husband's condition. Is it okay with you?
Yes, please.
Okay. Do you need anyone to be with you, a friend or a relative or something?
No.
Okay. Can we start by telling me what do you know about the condition of Mr. Mahmoud up till now?
Yes, doctor. Actually, my husband had been admitted in the hospital a few hours ago. We were at home. He suddenly felt that his left arm and leg are heavy. He cannot move his arm or leg. We immediately transferred him to the hospital. They told us there is a clot in one of the blood channels of his brain, and that his condition is under control, and we came at a very good time, and that it will respond very well to the medication. Actually, what I noticed that my husband's condition is deteriorating. He is nearly unconscious. He barely responds. He was transferred to the ICU, and I don't know what happened, why his condition deteriorated like this. He's connected to a lot of tubes and machines. So would you explain to me, doctor, what happened to him?
Yes, of course. I'm here today to explain to you what happened. Your husband, Mr. Mahmoud, was, admitted with a blood clot in his blood channels. This blood clot, you came in time, yes, but we tried to use some blood thinning medication to dissolve this blood clot and to relieve the condition.
Actually, they told us this blood thinner is a very good drug that going to resolve this problem completely, and that we came in a very good time, and they told us he will improve completely. So why is like that?
Yes, you did come at good time, but unfortunately what happened is a bad effect from the drug, which commonly happens. And I'm sorry to tell you that this bad effect had lead to some bleeding in his brain, and that's what caused the deterioration in his condition.
Bleeding? Oh, doctor, I'm confused. You mentioned at the start there is a clot, and you want to dissolve this clot. Now you are mentioning bleeding?
Yes, I appreciate your concern, and I know it's confusing for you, but let me explain to you more for this.
Yes, please.
Yes, this like any procedure, there's some complications or bad effects that can happen to any person. Okay, it does not commonly happen, but it might happen. What happened that the blood thinning medication, it worked, but it caused more thinning than it was intended to do, which caused bleeding in the brain, affecting the vital areas of the brain, which led to these areas in the brain are responsible for the consciousness of your husband, for him being conscious and for him to speak and to breathe. And I'm sorry for this, but that's why he is now deteriorating. The condition
Doctor,
is not.
Please give me a moment just to make sure that I understood well. You mean that
Yes,
the medication you gave him is the cause of deterioration of his condition? And you are telling me that this problem, this bleeding, affect the breathing and the important area in his brain? Did I got you in the right way?
Yes, I'm sorry to tell you this, but I appreciate your feelings right now. I know it's confusing for you.
I'm really shocked, doctor. How can this happen?
I know
I came with my husband
improvement.
walking. Just he was fully conscious. Just this weakness in his arms and leg, in arm and leg.
Yes. Okay,
so,
I'm telling you.
Are you going to give him some other medication or do operation to remove this bleed?
Okay, unfortunately, the consultant have seen your husband, and the bleeding is unfortunately it was a big one, and there will be no interventional surgical intervention, but we are giving him some medications to improve his condition. But most probably the vital brain parts are affected. I'm sorry to tell you this, and this means that he might not regain his conscious again. I'm sorry. I'm very sorry to tell you this.
I can't believe it, doctor. You know, we came to the hospital to help us, not to kill him. You are telling me he remained for the rest of his life on these machines and tubes? Are you telling me that he is not going to return back to home?
I'm sorry. I know. I appreciate your feeling. I know anyone in your condition would be
doctor,
angry.
Your rule is to keep the health of your patients, not to harm them. If you know that this drug has this serious side effect, you shouldn't give it to him. I think it is a sort of maybe experiment you run over your patient or something like this.
I completely appreciate your feelings, but let me explain to you. This procedure, if we didn't do this procedure for him, the result would be that he would not be able to speak, he would not be able to talk, he would not be able to walk, okay, and he would not be able to control his bowels or his urine or stool, so he would deteriorate more. This bad effect doesn't usually happen, but it's not common, but it can happen. And I think you have been counseled. I think nobody have counseled you before the procedure, and you have signed a consent.
No one told me anything about this.
You didn't sign a consent?
No.
I agree. This is a mistake. I apologize. You have to sign a consent before, and I apologize for this. This should haven't happened in our hospital, and on behalf of the medical team, I apologize for this.
Apologize? Now what is going to happen to my husband? I don't need your apology. I need to make sure that my husband will recover.
Right now, your husband is in the intensive care unit. He's being managed by a specialist in this field, and we are giving him all the treatment possible. And we are waiting for the improvement. But unfortunately, I'm sorry to tell you this: the vital brain parts are affected, which means the deterioration may continue.
What do you mean by deterioration may continue? Would you be more honest with me and tell me the full truth? Do you think I may lose my husband? He may die?
I'm very sorry. I appreciate your feelings. I'm very sorry for this, but I can tell you this: deterioration may result in his breathing. He cannot breathe on his own, and at this time may need a machine to help him to breathe. I want to talk to you about this
For
issue.
how long is he going to be on this machine, doctor?
Now? I'm sorry to tell you this. If he's not able to breathe, he may need this machine as long as he is living. But the expert or consultant, I think your husband have signed the DNR. Is this right?
I'm not sure about this.
Okay, I'm sorry to tell you this, but if he signed the DNR, it's better for him because it will end his suffering. He will suffer more if we connected him to this breathing machine, as he is not able to wake up, and at the same time this breathing machine has some bad effects which may occur due to prolonged use of this machine. We have to put a tube in his throat, and he may get some chest bugs. This may deteriorate more the condition, and also yes, please.
What is this supposed to mean? You mean that my husband is going to die, doctor?
I assure you, we are doing everything we could, and we are giving him all the medications and treatment.
You are telling me that the vital areas in his brain already damaged, and he is dependent on the machine. Now you are telling me that the machine cannot be maintained forever. So, what are you going to do? I'm sorry, but I couldn't understand you. I think that you neglected the care of my husband. You are responsible about what happened to him, and I will do every effort to keep you at home. You are not fit to deal with patients or to practice medicine even.
I apologize again. I know it's hard for you to, it's confusing and it's hard to digest all this information, and I apologize again. But if you want to do a raise complaint or something, it's your right, okay? But I assure you now, as we are talking, we have already taken some actions. Your husband is now being treated. He will not stop treatment, and this will not affect his treatment or management at all. And
okay,
an incident report has been written for this, and the consultant has been informed, and the high risk management team is already investigating this problem.
So,
if
writing
you want
an incident report means that you admit there is a problem and you are responsible for this negligence.
Only the problem was with the consent. You didn't sign the consent before, or nobody have counseled you about the procedure.
2 minutes remaining.
Okay. So I know what's your feeling now, what you know about it?
I really feel so bad, doctor. I'm losing my husband because of your own fault. You are the doctor who are supposed to treat him and help him. You put his life on the edge. I'm really feeling so upset.
I appreciate your feeling, and I'm telling you this: your husband, only this problem is a bad effect of the drug, and unfortunately the bleed has caused a serious damage to his brain. And as he have signed a DNR, we will give him all the treatment that he needs, except when it comes for the breathing machine, we cannot connect him to the breathing machine. And otherwise, I assure you, he will receive all the best management and care that he can have, and we reduce his suffering as possible. Again, I apologize for you for this problem, and I
really
appreciate
things will go in the good side.
I wish soon. Do you have any questions or concerns?
I'm concerned about raising complaint.
Okay, this is your right to raise a complaint if you like. And I assure you this will not affect his management. He will receive all the treatment that he needs.
Okay, doctor, thank you.
You're
Thank you. Now I'm going to stop a few minutes for the discussion. What is the medical issue in this scenario?
The medical issue is giving bad news, breaking bad news,
yes,
and dealing with angry patients.
What do you think the type of error here? Is it either negligence?
There is negligence in it's in the only the doctor didn't had consulted the patient, the relative about the procedure, and he didn't find the consent.
Should you, as a doctor, consult the relatives or the patient himself?
If the patient, the next of kin for the patient.
The patient was conscious on admission. Do you think it is proper to take a consent from his wife or from him himself?
No, from the patient himself.
Yes. So, do you think it is proper to write down an incident report if you think this complication?
As for the complication, no, it's because it's not preventable complication, and and it can happen. So it's not right to write
yes
an incident report.
Thank you, Dr. Amin. First of all, you run the structure in a very good way. Structured. Like you forget to mention in the introduction to ask if she is the next of kin of her husband, because she may be his ex-wife, and it's important to take care about this point. Another issue, when you try to explain, you mentioned to her at the beginning that is one of the common bad effects is bleeding. It is not common.
It's uncommon effect, but it can happen.
You correct yourself later on, but the start you mentioned common, فتake care.
Okay.
طيب طبعا consent from the patient, not from the relative, and you shouldn't counsel the relative from the for the complication of the medication.
Okay.
Do you want anyone to attend the meeting with you? Usually you tell this to the patient, not to the relative, unless you are breaking the news about that. If you
even this bad news that he is not going to wake up again.
Yes.
Okay.
If you want to raise a complaint, don't suggest complaint.
Okay.
Don't tell the relative or the patient if you want to raise a complaint. If she raised this issue, you should answer it as your right, but don't suggest the complaint. طيب نيجي بقى important issue you mentioned that the patient bleed affect the vital area on his brain and he is not going to recover. You don't know. هو mentioned في السيناريو الissue بتاعت DNR because you have to tackle it, لكن this doesn't mean إنه he needs resuscitation right now or you are going to do the resuscitation or prevent the resuscitation right now.
Okay.
But it's just you should prepare the wife to the expected outcome. So starting from the beginning, thank you for doing the scenario. You did it perfect. But take care of these points.
Okay.
Hello. النقطة remaining issue concern. Don't leave the concern till the end of the time. Once 2 minutes remaining, rush to ask about the concern and properly address, and then do everything else after this. Because you have 10 seconds, and I may or the surrogate may go through a lot of concerns. So take care. طيب, this is one of the scenario of dealing with angry relative. And in dealing with angry patient or angry relative, just to go through what I mentioned in the lecture before, you have to differentiate between two issues. Is it a complication or malpractice? Because both of them, each of them has a different approach. More or less, it is very important to listen to the patient or relative and let him express his feeling, express his anger and vent. And you did this very well. So how much you know about your husband's condition. I really appreciate your feeling and your worry, but I'm sorry to tell you that I have some bad news for you. Don't forget and keep breaking bad news in this scenario. Do the golden silence and then start to break the bad news. Actually, your husband has been admitted with this stroke due to blood in the blood channels, clot in the blood channel of his brain. And according to the hospital guidelines, or the guidelines, this is important statement because it gets you out from experimental drug or using improper medication or other conflict that you may enter with the relative. According to the hospital guidelines, we choose this blood thinning medication, and we decided to give him this blood thinning medication. Usually, before giving such a drug, because it has some serious effect, despite not uncommon, but it can occur, like causing more thinning of the blood and complicated by bleed. And actually, I'm sorry to tell you that this is what happened to your husband. He sustained a bleed in his brain. When his conscience started to deteriorate, we did urgent scan for his brain, and we discovered a large brain or big brain bleed. Actually, before giving such a drug with serious bad effect, we usually counsel the patient about the advantages and disadvantages of using this medication. And I assume your husband has been counseled before taking this medication as long as he was conscious. Why I'm telling that? Because I don't have in the scenario a clear statement that he was counseled. But it is the usual practice when you give serious medication to counsel about the pros and cons or the side effect of medications. When we did the scan, we immediately consulted neurosurgeon or brain surgeon, who decided that he's not for surgery. Unfortunately, this bleed affects the areas in the brain that is responsible about controlling breathing and heart beating. That's why he's connected to these tubes and machine. The situation now, I'm sorry to tell you, that is critical. At any time, we may face a situation in which his heart stop beating or his breathing stop. And in such situation, we may need to do resuscitation. When checking his medical record, we found that Mr. Mahmoud left do not attempt resuscitation order. I hope things will not go in this direction, but you should be aware about the whole picture. And I should be honest with you. I really appreciate your feeling. I really appreciate how hard it is for you. Anyone in your situation would behave the same way. I can understand how bad you feel. This is how to empathize with your patient in such situation. And then mention to her that he is receiving the best care. A group of well-specialized doctors are treating him, following him. He will be given all the medication necessary apart from resuscitation. Such scenario is important and it entails many subjects breaking bad news, dealing with angry relative because of complication and do not attempt resuscitation. So it is one of the complex scenario, has a lot of ideas, but it is important to cover the points that I mentioned and to avoid the points that I told you about in the comment. Another issue that I would like to stress on, if it is not mentioned in the scenario that there is a DNR order, you should tackle DNR. Why? Because his Glasgow scale is 7, which is very poor, and his situation is critical. He has stroke, and on top of it, a secondary major bleeding, which is inoperable. So the situation here is critical. So even if it is not mentioned in the scenario to tackle the issue of DNR, you should take it or comment on it, like I mentioned. I'm sorry to tell you that, but at any time he may be faced by a critical situation in which his heart stop beating or his breathing stop. And in that situation, we urge to take the decision of resuscitation. And actually, you start here to, if you don't have this DNR order, to tell her the medical team decision does not see this will be the best option, but anyhow, this decision will be discussed with you in the proper time or the time of need. So I just want to confirm on the items of dealing with angry patient due to occurrence of complication, not medical error, not malpractice. It is a complication of medication, provided that in complication of drugs, what makes you in the zone of complication or the zone of malpractice is the counseling, like Dr. Amina mentioned. If he was counseled about the bad effect of the medication, yes, he consented even verbally to take this medication and he knew the side effects, then there is no malpractice. But if he was not consented, if he was not properly counseled, and this complication is not mentioned to him, definitely there is malpractice. You should attentively listen. You shouldn't interrupt the patient or relative while talking. You should allow him to express his anger and appreciate by either verbal or non-verbal, like using the tone of your voice, yes, head nodding, keeping eye contact, appreciation of the feeling, putting into consideration anyone in this situation would behave the same way. Then after you listen completely, you tell him you totally appreciate his feeling and his anger, his or her upset, and anyone in her situation will behave the same way. But let me explain what happened. The second point, to explain, and then you put the plan. What is going to happen? What is the next step? You don't have to mention incident report or consultant informing or the high risk management team. These are mentioned in malpractice or occurrence of negligence or medical error. I hope I made it clear. So I just allow a few minutes to listen to your comments. We can go to the medical record. You can. It is not your right to go to the medical record if it is a complication. But if she mentioned that the patient was unconscious from the start, yes, you can. In this situation, you don't counsel the relative. If the patient is not conscious on the admission, you don't counsel the relative. You do the decision which is in the best interest for the patient. And in such scenario, the decision which is in his best interest is taking thrombolysis as well. Otherwise, the usual practice is doing counseling with the patient. If she raises a complaint, this will be checked in the medical record. So it is not your rule. If the patient or family insist on raising complaint for medical mistake, how deal with this scenario? طيب, for medical mistake or a complication, if it is a complication or mistake, it is the patient right to raise a complaint, regardless if it is a complication or mistake. If you are talking to a relative of the patient and the patient is conscious, the relative does not have the right to raise a complaint. But you mentioned to him to escape from the confrontation. If Mr. Mahmoud wants to raise a complaint, I will discuss this issue with him and I will guide him to the proper pathway because it is the right of the patient himself. In our scenario, the relative wants to raise complaint and the patient is not conscious, not competent. Yes, it's her right. in this scenario, because the patient is not conscious, not competent, it is her right. I'll guide you to the proper pathway or the patient advisory liaison service, and they will investigate it. Apology for medical error only? Yes. Apology is for medical error, but empathy for complication, medical error, any angry patient, you should empathize. But apology for medical error. You may say, I'm sorry, I'm feeling sorry, not I apologize. What about advanced directive and lasting power of attorney in such scenario? It's okay to ask about, but actually he already signed a DNR. If it is not mentioned that he signed the DNR, you have to ask about advanced directive. If we should raise the issue of DNR in a terminal case, better to ask about advanced directive of living in. If there is signed DNR like mentioned in the scenario, you should raise it. If it is not asked and the patient condition expected to deteriorate and need resuscitation, you should raise it after asking about advanced directive or lasting power of attorney. Thank you. Any other questions?
Hello. If patient came and that time he was unconscious and we didn't take any consent for thrombolysis, in that situation, if a surrogate is saying or wife is saying that nobody informed, do we need to apologize?
Yes. No.
Or no need?
No need. If the patient came to the hospital unconscious and no one from his family or the next of kin coming with him, and even if there is someone coming with him, and he didn't left an advanced directive or lasting power of attorney, then it is the medical team decision. The medical decision is for the patient himself, or to the if he left advanced directive, if the patient is not conscious, advanced directive or lasting power of attorney. If not, it is a medical team decision. The relative or next of kin does not take decision for the patient ever. You just involve them in the management plan to know the progress of the case, not to face a serious situation all of a sudden. You just make them sharing the progress of the condition.
No, I'm asking about thrombolysis. If nobody informed the relative,
yes,
and that time if bleeding is there, and it was not informed to patient because he was unconscious. So, do we need to apologize or no?
No.
Okay.
You mentioned like this. He came to the hospital not conscious. He was not able to take the decision for himself, and as long as he didn't left an advanced directive or lasting power of attorney, then the decision is based on the best of his interest. It's the medical team decision.
Okay, yeah, clear.
So you shouldn't apologize. No.
Okay, clear. Thank you so much.
Okay, let's move to the next case. Who is going to take it?
Can I take it, Dr. Mark?
Yes, sure. Anyone? Mean who I'm talking to?
Barakat.
Dr. Raghib?
Yes, I am here.
Who is telling want to take the kit? Sorry, I didn't hear.
Yes, I'm Dr. Barakat.
Dr. Ramona can.
Okay, Dr. Barakat, Dr. Raghib, we have 2 cases left. We have 3 cases actually. If you have time, we can continue. We will start.
Yes. Can you share the case list?
Yes.
Can you share the case?
Dr. Raghib, you will do the case. Okay. Mr. Sami has been, the case is apparent now. Sorry. Share just a minute. Mr. Sami has been admitted today for follow-up OGD for his longest-standing GERD. During sedation, his cannula was flushed by lignocaine instead of normal saline by mistake. He sustained ventricular arrhythmia, which was detected, and immediately the drug was stopped. He was then transferred to the ICU His condition is stable now and he is under observation. Your task to talk with his wife, Mrs. Dua, explain what happened and manage her concerns. You have 2 minutes. After them, we will start discussion.
Please, Dr. Awana, can you mention the scenario again? That's it.
Does it appear on the screen?
Yeah.
Mr. Sami admitted today for follow-up OGD for his long-standing GERD. During sedation, his cannula was flushed by lignocaine instead of normal saline. By mistake, he sustained ventricular arrhythmia, which was detected and immediately the drug was stopped. He was then transferred to the ICU. His condition is stable and is under observation. Your task to talk to his wife, explain what happened, and manage her concern.
Okay, Dr. Amuna, I can start.
Okay. Okay, start.
Hello, I am Dr. Raghib, one of the doctors taking care of your husband. Nice to
Hello.
meet you.
Pleased to meet you, doctor.
Yeah. Are you Mrs. Dua, the wife,
Yes.
the wife of Mr. Khan? Is that right?
Yes.
Yeah. Well, we are together today to discuss some issue related to the health of your husband. Is that okay with you?
Yes, please.
Yeah. Yes. First of all, I would like to check how much you know so far about your husband's condition.
Actually, doctor, I know nothing. My husband went out of home in the morning for a regular checkup of his food pipe because he suffered from this reflux disease. I found them calling me from the hospital telling that his condition needs my attendance and that he's transferred to the high dependency unit. I'm really anxious about what happened to my husband. So I here to know what happened.
Yes, well. So I am going to explain what has happened, honestly. First of all, your husband came today to the hospital for regular checking up of his condition. Unfortunately, while we are yeah, unfortunately, while we are in the operating room, and we start to give your husband some medication to control his. While we giving him some medication to control, to keep him comfortable during the procedure, during the camera test. Unfortunately, there is drug given by there is drug given by there is a drug given by mistake I am really sorry for what has happened.
So, how serious is this drug?
Yeah, I can understand your angry and your frustration. I can understand. I am really sorry for this. I am really sorry for what has happened.
Sorry, doctor, I don't understand what has happened yet.
Yeah.
Is my husband in a serious condition? Why he transferred to the ICU?
Yeah.
Would you tell me more about this drug? How serious it is? What
Well,
happened exactly to my husband?
Yeah, well, I am going to explain more. Yeah. Unfortunately, the medication given, there is a mistake. Unfortunately, there is medication given by wrong to your husband. So unfortunately, this drug induced a serious problem in the heart, in the rhythm of the heart. Uh, Once this problem happens, we are dealing with this problem immediately, and we are calling the heart doctor and keep our close eye in your husband. So, so, he developed abnormal rhythm in the heart rate. Are you telling me?
Yes, I'm just trying to understand. You
Yeah.
mentioned that you gave him this drug, and this drug is a serious one that caused serious racing of his heart. Am I right?
Yeah. This is what has happened initially. This is what has
Doctor,
happened.
I'm not, I'm an accountant. I'm not a physician. I'm not a nurse. But I where
Yeah.
hello?
Yes, Dr. Amon, I am hearing you. You can
Yes,
go.
doctor. Would you tell me how can this happen in a respectable hospital? How can you put my husband's life at risk? I'm accountant, and we usually in our work, we are not physician, we are not doctor, we are not dealing with patient's life. But despite this, we put important things, label them by obvious label. I think it is appropriate
Yeah.
for you to label risky drugs by certain label, not making them available on use by mistake. Do you agree with me?
Yeah, I understand. I understand.
Can I know who is the doctor who did this to my husband? Can I know his name?
Yeah, first of all, I understand why you are feeling in this way. We admit our mistake, and this mistake will not happen usually in our hospital. And we are taking, once this event happen, we raise incident report. We reported what has happened as a critical incident to the high risk management. And in same way, we are informing our consultant and we informing the supervisor nurse.
Doctor, I'm sorry, but I asked you a question. Would you tell me the name of the doctor who put my husband's life at risk?
Yeah, uh, um, I am sorry to tell you that what has happened is the mistake of all the medical team, not uh, not 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 the mistake of the member of the medical team. It is the mistake of the whole.
How can you explain such mistake, doctor? Why don't you separate serious drug from the usually used drug? Why don't you label it differently?
Yeah,
It's your
well,
rule. How can you say that it will not happen again? But it
yeah.
happened
So,
already.
would you like to inform you what is measures, what is action we are taking to avoid this to happen again? Would you like to inform me?
Uh, uh,
Would, uh, would you like to inform you?
I'm really feeling upset, doctor. It's okay. Go on.
Yeah, I understand. But let me reassure you that we are taking many action to avoid this event to happen again. First of all, we taking action that all serious drugs should be double-checked by the nurse and by the doctor before giving to any patient. We have to check and label the serious medication, and we are going to do a double checking of any medication before giving to the patient. So we admit
So
our.
would you explain how did this happen?
Sorry, Dr. Mona, can you?
Would you explain how this happened to my husband?
Would you explain?
How did this happen to my husband?
Yeah, I think what has happened is a communication problem. There is a break in the system in our hospital. We are admitting our and
Break in the system. You think this is safe practice? Do you think you are safe for a patient to come and receive treatment in your facility?
Yeah, I understand why you are saying that, but let me reassure you that what has happened is not happening usually in our hospital, and we will take every effort and we will do every action to prevent this to happen again. We, are you getting me?
Yes.
So,
Yeah.
I would like to.
What is the situation of my husband right now, doctor?
Yeah. Okay. After the problem in the heart didn't happen to your husband, we are keep close eyes on his condition, and fortunately he is going better now. And he is going better now, and already the action of the drug given is already going to finish.
For how long are you going to admit him to the hospital?
Yeah, well, this is a good question. We have to keep our close eyes in your husband's condition. We are usually doing many heart tracing to confirm that your husband's heart is okay and there is no future problem.
Okay, doctor.
So
for how long is he going to stay in the hospital?
Yeah, I think it is very difficult to, in spite of your husband showing marked improvement. But however, we have to consult our heart doctor before arrangement for discharge from the hospital.
Is this problem in his heart is permanent?
Unfortunately, let me reassure you that most probably these problems are related to the drug given. So we expected and we hoped that this problem will be temporary because your husband have no structure or no problem in his heart. What has happened is the abnormal point of the heart to the drug given by mistake. So we expect and we hope that he is going to be better.
Okay, doctor.
Okay, so I would like to reassure you that we admit our mistake, and I hope that you accept our apology on behalf of me and on all the medical team for what has happened, and we are going to discuss this incident with the high risk management team, and to be ensure that this incident will not happen again.
Yes, doctor.
You can go and check your husband. He is improving and going to be better. Okay. Do you have any other question or any concern you would like to ask me?
I'm concerned about raising complaint against your negligence.
Yeah, that's your right. I will refer you to the patient advisory liaison office, and I am reassuring you that the management of your husband will not affect by any way by the outcome of the complaint, and I will follow up the result of the complaint, and I will give you the feedback.
Okay, doctor, thank you. You still have time, Dr. Raghib, you can summarize.
Yeah. So I am going to summarize that we admit our mistake, and
Thank
we
you.
admit
Time
our.
finished.
Yeah.
Thank you. What is the medical issue in this scenario?
In this scenario, we are dealing with a medical error, with medical error, with
What type of error you think happened?
Yeah. What is the type of medical error?
Mm-hmm.
Yeah.
Is there a negligence or not?
To detect if there is negligence or not, we have to check if there is any harm or not.
You think harm happened or not?
But I think there is harm happening, and
Yes.
and also the duty of care is out is
Breached.
yeah.
Yes, perfect. Okay. Do you think if she asked you about transferring her husband from the hospital because she does not trust your care, what will be your answer?
Yeah, I am trying to reassure her that her husband going to be better, and most probably this problem. And I am reassuring her that we manage the complication happen properly. And
Okay, despite your reassurance, she refused to leave her husband at your hospital, and she want to transfer him.
I'm in this situation. I will ask her. We have to we have to involve our consultant in this discussion, and I will try to avoid confrontation with her by involving our consultant.
So the confrontation will be with him.
Yeah.
Take care. No,
What should I reply
this
this?
is not the issue.
What should
I'll
I
tell you.
reply this concept?
I'll tell you. Okay.
Yeah.
طيب, do you think she has the right to raise a complaint?
I think whatever. I think if the patient is conscious, she
He is
don't have the
conscious.
right to. Yeah.
صح?
So I think
Mm.
she didn't have the right to complain.
Yes, so take care when you answer this concern. The patient is conscious in this scenario, so you should tell her that you are going to discuss this issue with Mr. Sami, and if he want to raise a complaint, it's his right, and he will receive the best care. You will guide him to the proper pathway of the patient advised liaison service, and this will not affect his care. He will receive the best care without any indication, any discrimination. Sorry. Okay, Dr. Raghib, sorry. My comment on your approach. First, you have to ask, is she the next of kin of her husband or لا? Even she's his wife. Sometimes the partner is ex-partner. So you should make sure that you are talking to the next of kin of the patient. A scenario came before, you are talking to the son. He is angry because you breached his mother confidentiality and told his father, who is her ex-husband. So it is important to ask this question. And as long as the patient is conscious, I assume you took permission from Mr. Sami to talk about his condition. You are not allowed to talk about the patient condition without his permission, even if it is your task in the scenario. And take care, sometimes it is written in the scenario that she took permission from her husband. Even if it is written, you should ask her, I assume you take permission to talk about his condition. This is very important item when you are not talking to the patient. Then you ask her how much you know, start to rectify what happened. بس في breaking bad news, don't take much time to go through the subject. يعني your husband or Mr. Sami came today for regular camera test. Before doing this procedure, we usually insert a line or a special form of needle. During flushing of this needle, unfortunately, a mistake happened. We flushed it with a drug which caused serious racing of his heart. So I now can understand there is a problem and how serious is the problem. Don't mention only that you injected drug and it shouldn't be injected. Yes, what happened? Yeah, I don't know. I'm not doctor, and I don't know. Even if you mention the name of medication, I don't know what happened. How serious is the problem? So this drug, unfortunately, shouldn't be administered this way, which result in racing of his heart. Fortunately, this was detected immediately. We stopped giving the medication and transferred him immediately to the intensive care unit, where he received his proper treatment, and his condition is now stable. So you mentioned the whole story. By mistake happened. We injected drug that caused serious racing of the heart, which was elicited immediately. Stop the medication, refer to the ICU, and receive treatment, and his condition is now under control. How this could happen in the hospital? You should protect your patient, and I appreciate your anger. I really know how you feel right now. Anyone in your situation will behave the same way. Myself, if in your situation, would behave the same way. So I do appreciate your anger, but usually, let me tell you that usually we put label along on these serious drugs. I cannot say what happened exactly, but you know, mistakes happen, and this is not excuse. I cannot say برضه ان ده miscommunication لانه مفيش communication error here. ده drug taken from the car. So there's a mistake. في mistake happen. I cannot tell where exactly, but you know, mistakes happen, which gives us no excuse. We admit this shouldn't happen in this, the 3E. Admit this shouldn't happen in our hospital, and that is a serious mistake, and apologize on behalf of myself and the whole medical team for what happened. We hope that you accept our apology. This is the second E. يبقى admit the mistake, apologize for the mistake, and assure. And I would like to assure you that action taken in the form of transferring him to the ICU and controlling his medical condition, and he is now just under observation. And on the other part, to prevent this incident to happen again, and on to know who is responsible about this, I already incident report was written, consultant was informed, and the high risk management team is investigating. And Mr. Sami can know the result of investigation of this issue. Who is the doctor responsible? I'm sorry, I'm not allowed to mention names. The mistake is our mistake as a medical team. All of us here are one team, so it is our all mistake. For that, please accept our apology for this. Again, I would assure you that the condition is now stable. He is under observation. A team of our best is following up his condition, and you can visit him to make sure that everything is going okay, and that he's not this problem is temporary. It will not persist because he doesn't have underlying structural heart disease or a problem in his heart. He just has a complication of the medication which was stopped. For how long he is going to be admitted? 24, 48 hour maximal, till we make sure that the body gets rid of the medication of this drug. So this racing will not recur. Transfer, I'm sorry to tell you that, but transferring him may carry a risk for his life. If you want, you can have a second opinion. A second opinion is a patient right. Like, and transfer can carry risk because he may have this recurrence of this serious racing at any time, which may put him at risk while during transportation. So I assure you. But if he insists on transportation, not you, please consider who are you talking to. If you are talking to the patient, خلاص, this is his right, whatever he wants. But after you clarify the pros and cons or the drawbacks of doing what he wants and the importance of doing what you advise. But if you are talking to the relative, it is the patient decision if he is conscious. If he is not conscious or not competent for any reason, dementic, confused, whatever, it is either advanced directive, you have to follow advanced directive, or if there is someone taking the lasting power of attorney for him, or it is a medical team decision. If she wants to raise a complaint, I appreciate your feeling. I will discuss this issue with Mr. Sami. If he wants to raise a complaint, he's right. I'm going to guide him to the proper pathway and assure you that he will receive the best care without any discrimination. Clear? So just running over the 3A approach for dealing with angry patient. If there is medical error or malpractice, and malpractice is divided into 3 parts. Near miss, malpractice means something happened which is against best medical practice. Something against best medical practice. What decided best medical practice? GMC, or General Medical Council in UK. In near miss, it was about to happen but didn't happen. You know that the patient is allergic to aspirin and you was about to give him aspirin, but you remember, so you didn't give him. This is a malpractice, but it doesn't happen and there is no harm to the patient. The second level is the medical error or mistakes, in which it happened, but no harm. You give him the penicillin and then you realize that there is a problem, so you give him antidote or whatever, so he doesn't have any problem. No harm happened. In this condition, it is called medical error. If there is harm, he got anaphylaxis. In this condition, it transfers the situation into negligence. In all situations, if there is malpractice, you should follow the 3A technique. You should admit there is mistake, and this mistake shouldn't happen. You should apologize for the mistake, and you should assure that action has been taken in the past tense, whether medically, transfer to the ICU, referred him to the or consulted whatever the specialty needed, did surgery, whatever, the medical act appropriate to the situation. And legal act, 3 things: consultant informant, incident report written, high risk management team investigating. And you can know the result of the investigation if you want. This is the 3A approach in dealing with malpractice. So we took 2 different scenarios. One of them was a complication of a drug and the other was a malpractice. And the approach was slightly different in the apology and the legal acts that you are going to do. You don't have to apologize or take any legal action in complication. But in medical malpractice, you have to apologize, you have to admit, and you have to take medical as well as legal actions. Clear? Again, we'll give you a few minutes if you have any comments. Wife has no right for what? For consent?
I have a question.
Yes.
Who can request the second opinion? The relative or the patient?
Both of them. The patient لو conscious. Anything happened to the patient, if he is conscious, it is his decision. If not conscious or competent, a relative, no problem. The second decision, opinion is accepted.
Okay.
Thank you. Any other questions?
دكتورة منى question.
أيوة.
Sometimes they mention anyone want to raise a complaint just in order to not to go into conflict with him, you just refer him to the PALS office. But I don't know.
To the
you told
sorry again.
To the PALS office. Patient liaison advisor. So I don't know.
Police.
PALS.
PALS. Yes. Patient Advisory Liaison Service. Yes. PALS.
this is what's the right thing to do.
Yes,
Patient
and this
includes all details.
what yes,
Everything
this
has to
exactly what I
have-
mentioned. If you want to raise a complaint, it's your right, but the relative is different situation. The relative is different situation. You should يعني show يعني differentiate between you are talking to the relative or to the patient. Patient, yes, he's right. A relative have the right if the patient not conscious or not competent. But if he is conscious, in order to escape the confrontation, you mention to him, I will counsel about this issue with Mr. Whatever his name, and he has the full right to do the complaint, and I will guide him to the proper pathway or the pills, and this will not affect his care.
Thank you very much.
Thank you.
Hello, Dr. Mona. Usually they say that any person can go and they can complain and they can go to PALS. Even if a canteen man is finding something going wrong in the hospital, he can do. So in this situation, do we really need to say that your husband will do, or even she can go?
Yes, you should mention that because it is the patient right as long as he is conscious and competent. It is the decision of the patient. So if the patient does not want to raise a complaint and his relative want to raise a complaint, what do you think?
I think even they can complain if they feel that something wrong happened
No,
with
you
their.
should you don't discuss the situation unless with the permission of the patient, and you don't give the right except for the patient. And you shouldn't say to him, no, it is not your right, no, this is not the good way, but you just have to clarify that this is the right of the patient. And this is very important in the new regulation for the PACES, because you are not going to talk with the examiner, so you should be very clear in such debatable points. Clear?
Okay.
There were 3 A's, and then you said something else too. I don't know what is legal actions, medical and legal. Legal اللي هو informing the consultant, incident report, and high risk management team. This is the third E. فيها part medical, part legal. Any other questions? Clear? طيب, I hope I could make it clear the difference between complication, development of complication, or angry relative or patient due to complication or due to malpractice. So I'm going to discuss another scenario for dealing with angry patient. Who is going to take the scenario? Dr. Barakat?
Yes, Dr. Amar.
Okay. Mr. Ahmed, 45 years old gentleman who underwent biopsy from suspected lung lesion. He has presented with weight loss and anorexia. His examination revealed an enlarged liver, supraclavicular lymph node, chest X-ray, chest CT was suggestive of upper loop mass and liver metastasis. Thus, fine needle aspiration was done. He is here today to know the result of his biopsy, but unfortunately, the report of the fine needle aspiration is missing. Your friend who did the fine needle aspiration is on leave and his phone is out of reach. Your boss is out of the station. He instructed you to talk to the patient and repeat the fine needle aspiration.
Yes, Dr. Amar. Again, he has lung lesion.
عنده cancer lung. Sorry, Dr. Barakat. If the patient, just to answer, just to answer the question, if the patient is not conscious and the relative want to raise a complaint, yes, it's okay. The situation only refer to the patient if he is conscious and competent. Dr. Barakat, he has presented with weight loss and anorexia. Well, examination revealed hepatomegaly, supraclavicular lymph node. An investigation revealed right lobar lung mass, upper loop lung mass. Fine needle aspiration done من lung mass. And الريبورت lost. والcolleague who did the biopsy is out of reach. And you should inform him about this and about the boss decision to repeat the biopsy.
The patient himself. Yes. Can we start?
Yes, please.
Hello, Mr. Ahmed.
Hello, doctor.
I'm Dr. Barakat, one of the doctors in the clinic today. Nice to meet you.
Pleased to meet you, doctor.
Yes. May I confirm that you are Mr. Ahmed, 45 years old?
Yes.
Yes. Mr. Ahmed, I'm here today to discuss some issues related to the result of the snip taken from your chest. Is it okay with you?
Yes.
Yes. First of all, can I ask you how do you feel now, Mr. Ahmed?
I'm not feeling well, doctor. Actually, I'm feeling tired. I'm worried about the result of this snip. And I'm really anxious, doctor.
I am so sorry for this,
Thank you.
Mr. Ahmed. Be sure that all the medical team is beside you to support you, giving you the full care and management.
Thank you, doctor.
Can I ask you more about your condition?
Actually, doctor, I have been complaining of weight loss and tiredness over the last few weeks. I thought something like flu or something like this. I sustained abdominal pain and cough. I went to the doctor who ran some scans and mentioned to me that the scan showed some sort of lesion that he want to know its nature and asked for a snip from the lung lesion. I underwent this camera test and I'm really anxious about the result of my result, doctor, of my snip.
Yeah. I do appreciate your feeling and your concern, Mr. Ahmed. But first, can I ask you, did anyone talk to you about the possibilities of the results of this camera test and this snip? Or you have any expectation about what is going on?
Okay, doctor. No, actually, I don't have real words. Just told me that there is suspicious growth. We are not sure, or you have to make sure the snip will reveal the nature of this problem exactly. So I'm really worried, doctor.
Yeah, I do appreciate your feeling, Mr. Ahmed, and
Thank you.
I'm sorry about your suffering. Actually, you did. Do you want me to explain more about your condition, if you don't mind?
Yes, please.
Yes, Mr. Ahmed, the results of your workup and your labs revealed that you have a mass in your chest and another mass in your liver. Also, there is some bumps and some lumps in your body. This is what we call the enlarged lymph node. This is highly suspicious or make us so worried about this is the possibility of some muscle growth or cancer. I am so sorry about this. For this. Yeah.
So this snip, doctor, confirmed the cancer?
Yes, I will come to this point now. If you allow me to explain more, we take this snip in
Yes,
to
please.
know what is going on exactly, what is the nature of this mass, and to decide what is the correct management plan that we should do. Unfortunately, Mr. Ahmed, um, I have unhappy news for you that this snip, we lost it.
Sorry, I'm not sure. Did I hear you right? You lost it? Are you kidding, doctor?
I'm
You
so
lost
sorry
it?
for what happened.
I'm
I
waiting
do appreciate your
on my
feeling.
nurse for the last 4 days, waiting for the result of this snip. And you are telling me that you suspect cancer. And justly you told me that you lost it. How you lost it?
I do appreciate your feeling and your worries.
Are you really a hospital? You know how I suffered during this camera test? I thought that I'm going to die. I can't imagine how negligent you are. Lost it? Are you serious? How can this happen?
I do apologize.
What is your recording system? Are you keeping your patient records? I'm sorry to tell you that, but it is a respectable place. You should keep your records in with safety. How could you lost it?
Yeah. I do appreciate your feeling, Mr. Ahmed, and I am so sorry for what happened to you. And on the behalf of the medical team, we are apologizing to you for what happened. We are so sorry. There is a gap of communication in our system that leaded to loss of your SNP results. I'm so sorry for what happened, and I do appreciate all your worries and your feelings. This is your right to worry about it.
So
And
you I don't know what to say, doctor. How can you lose my result? Is there another copy from it? Anyone who knows the result? How can you lose
yeah,
it that easy?
I am so sorry for what happened again, Mr. Ahmed. And I know this is hard time for you, and this anyone in your place will be upset about what happened. But be sure you are not alone in this situation. We are all the medical team here is beside you, and we are doing our best to discover what happened and to avoid this from happening again, and to find any solution as alternative to what happened. I am so sorry for this, Mr. Ahmed. I
So
wish
what is going
you
to
will
be done,
accept our
doctor?
apology. First, Mr. Ahmed, due to your condition, we decided to repeat this step again.
Sorry? You want to repeat it again?
Yeah,
You want me to do this camera test again? No way.
unfortunately,
No
we
way.
need to do this.
No way, doctor. It's your own fault. You can. There is a doctor who did this snip. Where is him? Why don't ask him?
Yes, he's in vacation now. We tried to contact him, but we failed.
No, I can't believe it. How can this happen in a hospital?
I'm
I'm
so
just
sorry.
thinking that I'm in a big joke. This shouldn't happen. I can't imagine. I can't go through this test again. No way, doctor. It's your
I do
own
appreciate.
fault. And you have to manage it. You have to find your colleague. And you have
I
to
do
find
appreciate
my
your
result.
feeling, Mr. Ahmed, and your worries. Be sure that
It is
we
not
did our
worry,
best.
doctor. I'm very upset from your way of caring. You are not caring after your patient. If you are considering cancer, you are considering serious problem. You are talking about my life.
Yes, I
And you
know
are
this is
just
unacceptable fault.
telling me that you are going to arrange another time for the procedure and wait for another day because of your own fault. Do you think this fair?
I can't imagine how we can make up you, Mr. Ahmed, but be sure that we are doing our best to do your management plan as in correct way. But
No way to do
unfortunately,
this snip
happened was.
again. No
Can
way.
I
I
ask you
can't go through
if
this
you don't want?
experience again. I told you, doctor, this was very painful experience. I don't want to repeat it again.
Yeah, we can manage this issue, Mr. Ahmed. According to this pain and your concern, we can try to give you some painkiller and we can give you some drugs that will sedate you, make you more sleepy, not to feel pain during the procedure again.
I'm not sure, doctor. I don't think this is the right solution. I don't think that I'm the one who have to pay for your fault.
Yeah, I know, but we, as I told you, are caring about your condition, and without this sleep, we can't define the correct way of management that we can offer to you. So
There
we
should be a way of communication with your colleague. You should communicate with him and tell him where he put my result instead of putting me at risk again.
yeah, I do appreciate your feeling, Mr.
Why you are
Ahmed.
just taking it easy to repeat this procedure while you have
I
easier
want,
solution to find out where is my result.
yeah, I want you to know that time in your case is precious. Every day that passes is
If you know this
precious
time is
in your life.
precious, how can you lose it?
Yeah,
You are the one
actually,
responsible
this
about
is not accept.
losing the
Yes,
time.
I am admitting that this is an acceptable fault, but be sure that we are not. This is wasn't intended to lose your step, or this is was a gap in communication in our system. that we were working in it. We did, as I told you, incident report and informed our consultant and the chief nurse about, and also the tissue doctor about what happened to the medical team specified in this cold root disease or high risk management team that will assess this and will find the cause of this to to avoid this from happening again to you or anyone else. But let's focus more in your condition, Mr. Ahmed, that we are caring about your condition and we need to do this snip again.
If you are caring, you shouldn't lose my result.
Yeah, I told you I am sorry about what happened to you. But
what can I do with your sorry? I need the result of my snip 2 minutes remaining.
Okay. Do you think how I can make you up, Mr. Ahmed?
I'm not sure, doctor. I'm not sure. I just want to find a solution, but I don't want to repeat this painful experience again.
Yes, can you explain me why, other than this pain, why you are refusing to do this again?
Because all of these risks and the bad experience I have been in, I don't want to repeat it again.
Yes, I do appreciate your feeling, but as I told you, we can offer you some sedation or some drugs to keep you sleepy during the procedure, to avoid uncomfortable ways of any pain during the procedure. Also, we can afford you some painkillers.
How can I make sure that you are not going to lose the results this time again?
Yes, I will check it. I will deliver it myself. I will be sure that it will be not lost. As I told you, this we did our best to avoid this from happening again to you or anyone else. Another thing, Mr. Ahmed, I wanted you to know, without this snip, we can't do correct management plan. We can't put a correct way to treat your condition. This is better for your health.
Okay, doctor.
So if you want time to think, I can arrange another appointment with you to discuss more about this.
No, it's okay. I can do this. It's okay.
Yes, if you
but I hope
this,
you are the one responsible in front of me to keep the result and that I'm not going to suffer again.
Yeah, I will do my best in this situation, Mr. Ahmed.
Thank you.
But I want you to assure that.
ماشي لا هم 12 دقيقة. You can continue.
Okay, if you decided to do this procedure, there is another consent to sign. This is the same that you signed before. The paper just contain what we discussed and what is the procedure will, how the procedure will done and what is the possible bad effects of it. This is you will be signed by you again before the procedure.
Okay, doctor.
Okay. I assume that this procedure is explained to you before, Mr. Ahmed.
Yes. Yes.
Yes. Do you want me to explain more about it or explain anything regarding this procedure?
Concern.
Okay. What is your concern, Mr. Ahmed?
Concern about raising complaint against your colleague.
Yes. I'm sorry about what happened to you, Mr. Ahmed, and I want to right. I will advise you the BLS office, Patient Advisor License Office. This will follow up with you regarding your complaint and will advise you more about what will happen and what we will do next. And be sure, Mr. Ahmed, that we will still doing our best for your care.
Thank you, doctor.
Actually, this will not affect your management plan. There is will not discrimination according to this complaint.
Thank you, doctor. Perfect, Dr. Barakat. But the tone of your voice get irritated by the end, near the end of the keep.
عشان سمعت جرس المنبه وانا موعود
لسه. لا قبلها بشويه. Just take care. Keep a calm, confident tone of your voice. Don't show irritation or stress in your voice. Whatever the reaction of the surrogate to you, or how aggressive is he, don't take it personal, and keep confident, calm conversation as much as you can, but caring at the same time. Don't appear careless. You did it perfect. الابسوربشن بتاع الايموشن كان ممتاز. Perfect. Structure very well. You explained what happened. Definitely the medical issue here is
medical error. or negligence.
Medical error or negligence, yes. There is harm because you are going to repeat the procedure again. And there is no excuse to miss a report, especially invasive procedure like this. So in such situation, you should admit this shouldn't happen. But again, you have to clarify why there is no backup for this report. I'm sorry to that, but the doctor who did this biopsy, who had the SNP result, is abroad now. And unfortunately, we lost communication with him, and his vacation will take long time. So in order to save time, because we are in a critical situation, I'm sorry to tell you that, but our consultants see that we have to repeat, or better to say, should repeat this SNP. I appreciate how hard this for you. I'm really sorry to tell you that. Take care بس يا دكتور بركات from using medical term. مش mass growth ومش lymph node glands.
انا قلت لها لامبس وبعد كده قلت لها وات وي كولد كذا يعني عشان ما لقيتش في ميدان اكتر.
glands او lymph glands. طيب there is a gap of communication. حضرتك ودكتور راغب برضو mentioned the same. We admit we have a gap in communication. لا, there is some sort, maybe there is some sort of miscommunication or lack of communication. I admit there is a gap of communication in our system. يبقى you have a failing system. I'm just talking, الكلمة مش غلط لكن الارrangement بتاعت الكلام بس هو لا. There is a gap, you admit إنه في problem in the system, so your system is failing system. No, I'm sorry for that, but maybe or perhaps there is a sort of misconduction of information, miscommunication. I'm not sure what happened exactly. لكن gap in system, you admit إن this is a very يعني disastrous word. You understand me? فتake care بس of this. لكن otherwise you did it well. Perfect thing you did when he insisted not to do the biopsy and is telling you it is your fault. So how can I make it? In your opinion, خلاص, give me a solution. You can give me a solution. I give you my solution. What do you think, in your opinion, the situation? We are at a critical situation. We cannot wait for a long time, and we have to know where the cancer started. Probably it started in the lung and traveled to the liver, or the reverse happened, and the management may differ. Oh, actually, both of them is a stage 4 cancer, and you are talking about palliative care. لكن السيناريو want to run it this way, خلاص, it's okay. يعني هنا it will not differ much from where يعني biopsy just confirm إن هي cancer وخلاص. But anyhow, you should follow the scenario. So the solution right now, I know it is difficult for you, but to repeat the SNP.
دكتورة منى ممكن. الو.
ايوه دكتور اتفضل. الو
في الحالة ديت ممكن يس دكتورة منى. The SNP is to differentiate between what is the sort of lung cancer. Maybe if it's squamous cell carcinoma, it can take chemotherapy even as a palliative for just
in all the stages, in all the cases, it is metastasizing cancer. They are talking about palliative care, not curative care. You understand me?
Even the way of palliative care will differ.
Palliative care means keeping the patient away from pain. Okay, you give radiotherapy if there is bone metastasis to control the pain. The palliative care,
as in case of cerebral obstruction. In case
okay, but they will not
differ according to the type of cancer. It will differ.
Cerebral obstruction not detected by biopsy.
The type of cancer.
Sorry.
We need to diagnose the patient first if he has lung cancer or liver cancer with metastasis. to proceed with palliative care, even we need to know the diagnosis. The type of the cancer is essential to put the
لا, you have to diagnose cancer, not the type of cancer. You have to diagnose cancer, not the type of cancer, because you don't have a proof for cancer. You have, in order to say the patient is in terminal cancer, you have to diagnose him عنده cancer. انت you have suspicious lesion في CT and liver nodules or liver mass. This suggest, but you prove cancer by biopsy. لكن whatever the type of biopsy is, it is a stage 4 cancer. This for palliative care, Macmillan team, pain-free, supportive care, not for active treatment unless there is complication. يعني ايه complication؟ حصل بوم متسس هعمل له راديوثيرابي عشان minimize the risk بتاع الفراكشر. حصل. You understand me؟ لكن type of cancer here does not differ in the management. You do the biopsy or re-biopsy to diagnose cancer. لأن ما عندكش, you cannot say it is cancer based on imaging. You have to have a biopsy finding. You understand me? لكن as long as it is stage 4 cancer, خلاص the stage 4 cancer. Whether it is from the liver, whether it is from the lung, خلاص it is stage 4 cancer. You understand?
Yes, دكتور.
يعني أقول لك على حاجة يا دكتور. You have a patient with malignant pleural effusion. This is one of the scenario came in the exam, and you don't know where is the primary. And the patient insists to know where is the primary cancer. Would you go through a series of investigation to look for the primary? Does it differ? Is it ovarian ولا uterine ولا colon cancer ولا whatever?
No, it is very
No.
bad diagnosis.
Why? Because it is metastasizing stage 4. فالليفر واللنج pleural malignant effusion والبرين والبون ده وطبعا الليمف نود ده stage 4 cancer خلاص. ف you are not going to mention staging, بس انت why you need the biopsy to know to have a tissue prove that he has cancer. Till now حتى السيناريو مكتوب suspicious. You don't care. You cannot say to the patient we are going to start palliative care based on suspicion. You got my point? Whatever the cancer is, in a stage 4 cancer, you treat by palliative care. Sometimes the type of chemotherapy that is not used to treat, no, just control the gross to prevent more damage or delay more damage. Sometimes for stage 4 cancer, the chemotherapy itself carry more risk, and the doctor refused to give the patient chemotherapy, except if he insists. يعني في one scenario, patient has cancer in his bowel and in his stomach, and he has stage 4, and he insisted to receive chemotherapy despite the doctor were refusing. So they started him لأنه كان young age based on his and his parent decision. And then he entered into torrential upper GIT bleeding. Torrential يعني uncontrollable bleeding. He is in a very bad situation. ففي الاكسبلانيشن بتقول despite انه في بقيه السيناريو يقول despite انه الكيموثيرابي stopped because he got worse on the chemotherapy. So sometimes in stage 4 chemotherapy is not acceptable by doctors because chemotherapy itself is a killing for cells. Not only the cancer cells but also normal cells. Sometimes the risk of them more hazardous. ده مش unifying لكل الكانسر، واحنا اتكلمنا عن الكانسر before good prognosis bad prognosis cancer. لكن anyhow generally speaking stage 4 metastasizing cancer خلاص ده احنا بنتكلم palliative care. لكن here you have to have the biopsy to verify that he has cancer، لأن كل الإيفيدنس بتاعك lymph node و enlarged liver و lung mass في الCT which does not verify cancer. highly suspicious definitely. لكن where is the proof? Clear? important again the good point that you took, that you mentioned to him. So how do you think the solution for this problem, or how we can get this or get through this problem. So if he refused your option, tell him what is his solution. Very important, don't go into struggle with the patient. Why? He refused to do the camera test again. Why? It is pain. I'll give you painkiller. Discomfort, I will assure you that I will attend with you, and I'll bring one of, or make the one who is doing this, who will do this procedure for you, one of our best consultant, expert, to minimize your discomfort. I will assure you that I will follow the result of the SNP myself till I bring it back for you. I do apologize for what happened. I admit this shouldn't happen, and there is no excuse for us. But again, this is under investigation right now. Consultant informant, incident report written, and high risk management team investigating. If you want to raise a complaint, it's his right to raise a complaint. Clear? Hello?
Yeah, thank you, Dr. Mona.
Thank you. كل lymphoma could be lymphoma is curable. Lymphoma in most cases is curable. We have two types of lymphoma, Hodgkin and non-Hodgkin. الهودجكن بتيجي في young age, and this is the usual scenario we face in cases. non-Hodgkin في elderly, ودي depends on type. Even الهودجكن lymphoma, majority curable, but can recur. So the importance of long-term follow-up, but there is minority which is serious, maybe fatal, not curable. لكن المajority عشان كده when you talk about lymphoma, you have to mention that it is curable in most cases. Most cases have good outcome. Any other questions or concerns? Don't wait for the concern. Take care of the concern, دكاترة. All of you today delay the concern too much. But take care. Any questions? Anyone want to ask or comment on anything? Last time we met, we discussed genetic counseling, and we mentioned that there are two types of genetic counseling: counseling about treatable or preventable disease, and in this condition you encourage the counseling, and counseling about non-curable or non-preventable or treatable disease, and here you discourage. You don't have to give decision, but you will be on the discouraging side. And we mentioned there is two particular situations, اللي هو الهوكم والpolycystic kidney, where there was a debate about the age of counseling. الpolycystic kidney, by the age of 18 years you do the ultrasound. السيست بتستارت الابيرنس من 15 year, because one of the doctors sent me انه السيست الكونسلنج screening start في age of 15. Yes, the cyst start at the age of 15. But any member in the family of autosomal dominant polycystic kidney can have cysts. So it is the significant number of cysts which appear by the age of 18. طيب, this is for the HOCM, for the polycystic kidney. For the HOCM, there is a very huge debate about HOCM. Very huge debate. But anyhow, if the patient, according to the consensus, and this is from European Society of Cardiology, which is the guidelines for cardiology, the society responsible about putting the guidelines زي الامريكان هارت اسوسيشن in Canadian او الامريكان guidelines. الاي اس سي هي في اليو كي واليوروبيان countries دي الجايدلاينز بتاعت الكارديولوجي. بيستيت ان لو البيشنت بيكسبيرينس strenuous exercise او عنده family history of early death, he can start screening by the age of 12. في papers على age of 10. وفي على age of 18 but anyhow as a consensus آخر حاجة في ال ESC ال 12. Any other questions or comments?
Sorry, Doctora, so echo at age of 12?
12, yes. All children should be start screening by the age of 12, yes. By echo and ECG.
And
the voice is not clear. Again, please.
Dr. Mona?
Yes.
I had a question. I wanted to know, how do we incorporate ice in such a scenario? Like if the SNP test is lost, we'll start away, in the starting, we'll say that, do you have any idea what could be the results? And then we'll say that, what do you expect today from our discussion?
Actually, you don't have an answer for these questions because you missed the result. So you just tell him, you know why this SNP was done? What's your idea about the your problem? What do you expect the result? And start to explain, or how much you've been told by other doctor about the why this test was done. Actually, the your condition revealed, or your scan revealed that you have a growth in your lung, as well as growths or multiple growths in your liver, and some nodes, lumps or lymph glands in your neck, which raise a suspicion of nasty growth. I'm sorry to tell you that, but this can be confirmed by the SNP. Again, I do apologize but I have some bad news for you. Unfortunately, after doing this SNP, when checking your record, we missed the result of the SNP. We tried to have another copy, but unfortunately we failed. I'm not sure what happened exactly. There may be, or perhaps there is a sort of miscommunication or misconduction, but the result was lost. And the doctor who did this SNP is now in his annual vacation. He will not return soon, and unfortunately we lost methods of communication with him. So
All right.
we are now faced by a critical situation in which we have to know the result of this SNP, and this will not be applicable except we do another one. I know it is very hard for you to accept this, and I know it is painful experience for you, but this is our only solution to overcome this problem and know the results, so start the proper treatment accordingly. Let him express his anger, empathize, agree with you completely. You have the whole right to do like this, and it is our own mistake.
Do we again apply the 3 approach, like apologize?
Yes, definitely.
Okay.
There is malpractice here. Yes, sure.
Yeah.
Any malpractice, you should apply the 3E approach.
And in assurance, what we will say? Like,
I assure you that incident report was written. Consultant was informed. High risk management team investigating how did this happen to prevent it from happening again and to punish the one responsible about this. And you have the right to know the result of the investigation if you want. But medically, the medical assurance, right now our consultant sees that the best is to repeat the SNP. So how do you feel about that?
all right.
So when you take the story, you give the details, not waiting till the patient asks you, but give the details. You preserve your time. You got my point?
Yes. So
طيب.
you are quite right in saying that like the assurance will be, we will inform the consultant.
Legal.
Yeah.
Yes.
And high risk team management will be informed. And there was one more thing that you said.
And the medic incident report.
Incident report. Okay. And
Yes.
what are the, like, what will be the non-medical term to be used for meds, like bone meds, or she had like liver meds?
Seedlings.
Seedlings. Okay.
Yes, seedlings or sent some nasty growth to other parts like your liver, like your glands, lymph glands.
All right. Okay. Thank you.
Mm. Thank you. Uh, prepared list of the common words. Okay, حاضر. Mhm. Any other questions? We can have another scenario. Who is ready to practice? Thank you.
Can I do, madam?
Yes, sure. Your name, doctor, please?
Dr. Kausar.
Welcome. Okay. Mrs. Sameh is the wife of Mr. Rami, who has been admitted after collapse at work. His investigation confirmed a diagnosis of meningococcal meningitis. He is now admitted to the ICU with Glasgow Coma Scale 7. Your task to explain the condition to his wife and manage her concerns. Sure.
Okay. Hello, good afternoon.
Hello, good afternoon.
Are you Mrs. Sama?
Yes.
And you are wife of Mr. Rami?
Yes.
Okay, so you are next of kin?
Yes, I'm his wife.
Okay, I'm Dr. Kausar, one of the doctor here. I'm here to discuss about your husband health condition. Is that okay with you?
Yes, please.
Okay, so may I know what do you know about your husband condition so far?
Doctor, my husband have been sick for the last 2 days. He was having fever, headache. Um, I thought that there is that he catched flu or something like this. He took just some pills for this problem, but they called me today telling that he collapsed at work and he was transferred to the hospital. So when I came to see him, I found him on the ICU connected to a lot of devices, machines, tubes. So I'm really anxious about my husband's condition. What happened to him?
I'm sorry to hear all these things about your husband condition. May I know what do you think? What could be the reason?
I'm not sure, doctor.
Okay, and what is your expectation from our discussion today?
I want to know what happened to my husband.
Uh-huh. Okay, I appreciate your concerns and thinking about your husband, Mrs. Sama. Let me tell you, when your husband came, he came in a collapsed condition. He fell down somewhere, and after that, we brought him, and we found that there was. I'm sorry to tell you, I have some bad news for your husband.
Oh,
Okay,
what do
so
you mean by bad news?
I'm afraid to tell you that there is some serious infection which is affecting which is invading and involved with his layer of his brain. So let me draw this picture. So first thing that I will just draw this, and this is the layer of brain, and here he got the one infection. So that's the, it is called meningococcal meningitis.
Yes, doctor. How serious is this condition?
Okay, so actually this is an infection which is quite serious. Once it comes to the brain, first it involves with any part of our body, and then it goes to the brain. Once it goes to the brain, because of that, he is not very fully conscious. And the consciousness scale, which normally you and me is like 15, for him it is around 7.
Which means, doctor?
Which means, he is quite drowsy, and I'm afraid to say that maybe we need to, put him on an artificial machine later, or very soon. We have to assess, and maybe we need to put and he's deteriorating actually.
Doctor, you mean that my husband is going to die?
I appreciate your question.
Is this machine is just temporary treatment, or?
Yeah, actually, see, yeah, it is not. See, it's too early to say whether he is going to die or not. But let me tell you, this is a serious bug infection, and we started already treatment. And the doctor and specialist who is responsible for dealing this infection, they are already taking care. But since because of infection his brain is not alert, so maybe for temporary we need to put in ventilator also. That is a part of treatment. Are you getting me?
So is he going to recover, doctor?
I hope so. It's too early to tell you. We'll have another meeting later and we'll get back to you how he's doing. But usually when it is already affecting the brain, we start with the injection, and we are keeping them in a isolation, because in a separate room, because people who is coming, they can also get infection, and it can affect them. And since it is a serious bug infection, it can affect their family member as well.
Okay, doctor, again, I just want to confirm, am I going to lose my husband?
See, it's too early. I am sorry to tell you, I cannot give you precise answer. But your husband is now, getting care by a team of doctor, in which, as I told you, the bug infection team is there. Also, ICU specialist is there, our consultant is there, dietitian and nurses, and everybody is taking care. And we are putting him in an isolation room. So let's see how he is. Sometime, I'm sorry to say, people can deteriorate, and they can, sorry to say they can die. But still, we team are trying our best to make him to recover.
So, doctor, you think my husband will follow which way? From your experience, or what do you expect?
See, it depends on many things. It depends on person age, whether he's diabetic or not, how the defense mechanism.
He doesn't have any problem before. It is the first time. He's just 39 years old.
Mm-hmm. Usually this kind of people, chances of recovery is there, but we cannot give you any promise right now. We'll see how he's doing, and we'll get back to you every day, and in the morning and evening meeting, how you are doing, how your husband is doing.
Also, you cannot give me any idea about what can happen in the future.
I'm
just sorry about his condition. I was shocked when I saw his condition right now.
Yeah, there is chances that, as I told you, his brain consciousness level is not so good. So there is a high chance that sorry to say that, whether he will recover or not. I'm afraid to say that there's chance that he will recover. May I know that your husband has any earlier any discussion in case if he would be in this condition, what we need to do, what kind of treatment we should offer him? Anything he wished earlier or any?
No, never, never. He
Okay,
never thought about this, doctor. You know, he was
okay,
very healthy.
okay,
Mhm.
okay. Anything, any lasting power of attorney or anything he
No, no,
made?
no,
Okay.
no.
Anybody was sick at home, and any colleague or any his friend was there?
Actually, my 3-year child started to have fever. I noticed that he's feverish today.
Mhm. Okay, I'm really afraid to hear that, because as I told you, as I wanted to tell you that when this person, any person, this kind of bug, they infection they have, usually any person who is visiting, either old people or children or pregnant lady, they have very high chance to get this infection. So in that situation, I really want you to take your child and to be evaluated by child specialist. That's really important.
Oh, yes.
Okay. Who is living with you?
Me and my kids, 3 kids, and I'm pregnant actually.
Okay, okay. So I would like to tell you, Mrs. Sama, that it's good for you also should not to visit your husband. Although sometimes we allow by wearing gloves, and there are certain local protocol of our hospital to mask and gloves and all, but your defense mechanism is already weakened, and I don't want you to get this infection. So that's how do you think about this?
It's okay, doctor.
Uh, Okay, and may I know that do you have any questions or anything, any concern?
I'm just anxious about my kids. Should my young kid have caught these bugs? And also, is there any precaution that myself, as I told you, I'm pregnant, or my kids, other kids, take it not to guard against getting these bugs?
Yeah, you are thinking in a right way. We need to, test every member of your family, and also should not allow children to go to the school if they are going. Till that time, we will test them, because they can also spread this infection, and we would like to test them as well as your test also very important, and we need to give some certain kind of medication to your kid as well as you. So I would like you to also check yourself from your GP, and also for your kids by the child specialist doctor. Does it make
Okay,
sense?
doctor. Yes, sure.
Okay, and may I know that
Is it safe for me to take these drugs
there
because
are
I'm
certain
pregnant, as I told you?
Yeah, yeah. There are certain medication which we can give, which is quite safe, as per the guideline. It's not so dangerous. Rather, not taking will be more harmful for you as well as for your life as well as for your baby. So,
Yes, doctor. Okay.
are you getting enough support, or do you feel to me to
To my
offer
swimming?
any help or anything who can take care of your child?
No, thank you.
Okay, are you working?
Yes.
So even for you, as I said, let go for first test, and if test is negative, then only better
Doctor,
to go.
one more question, please.
Yes, yeah.
Um, my son, the older son, is 6 years old. He has exam tomorrow. Shall he go to the school?
We can, write a letter for school, and will involve social health worker. They will actually involve with how they can conduct, whether there is any isolation room where they can conduct, or there is any other way they can
But
take later.
he doesn't show any fever or any problem. Should they know
Okay,
about this?
yeah, we'll check first today, and and if it is it's not positive with he can go, but before that he will take medication.
Okay, doctor.
So anything do you want me to help you, or is it not clear?
Yes, please. Yes, it is clear. You made it very clear. Thank you.
Okay, so let me just, I'll give you some brochure and leaflet about this bug, that how serious this bug is, and we'll keep evaluating your husband, and also we'll share some contact detail of our hospital. Any queries or any worries, we are here to help you, and you can feel free to call us. Okay.
Okay, doctor. Thank you.
Okay, so okay, so just let me summarize you that he has a superbug infection on the layer of his brain, and most of the time, it depends on the person defense mechanism. But we already trying our best. Although his serious condition, I'm afraid he's critically ill, should not deteriorate further. But we whole team are trying our best. Okay, thank you very much.
Thank you, Dr. Perfect. By the way, I make the time over 12 minutes in the exam. In the current exam, you have 14 minutes.
Mhm.
Anyhow, you did well, but let's check some medical issues here. What is the medical issue in this scenario?
Medical issues is it's a patient who is having a meningococcal meningitis, and his GCS is the really not so good, and maybe he will deteriorate and he will go on ventilatory support. And this is another thing that
he
it
will go, or you think he's already on ventilator support?
Usually below 8 we put, but in scenario it was not written, so
But
usually
she
below.
mentioned that he's connected to these devices and machine, and you have this
Okay.
Glasgow coma scale, and he's admitted in ICU. So it is
Okay.
important to yes. So prognostically, what do you think the prognosis of his condition?
I think his prognosis is not good.
Yes.
Although there is one thing, only young age, maybe. Otherwise, it's not good.
You mentioned to her about the importance of screening. She has a sick child. Should you stress on admitting him and starting treatment for him?
It's good to have an evaluation by a child specialist, pediatrician, and most probably he also got infection, and actually he need to be admitted, and he has to be under close observation.
Yes. What is the prophylaxis used for meningococcal meningitis?
It is rifampicin and I think ciprofloxacin.
Yes. You think it is safe for her in pregnancy?
For her, I think we can give cefixime or ceftriaxone.
Okay. What about her kids?
Kids can take rifampicin. Ciproflox is not safe for them. It can cause the tendon rupture and also cartilage rupture.
Perfect. What about the job of her husband? Is it important?
Yeah, it is important to know, but I didn't.
If you think that he is a school teacher, does it matter?
It means that most probably he got infection from his school, from children.
You think you should do tracing of the child in his class or the?
Yeah, it is really mandatory, and I think it's not notifiable as well, or I don't know. I'm not sure.
It's notifiable.
Yeah, so it's notifiable.
Okay, thank you. Thank you, Dr. Kassar.
Thank you.
You did it well. Structure is perfect. You broke the bad news in a good way. And you asked if she was or she is the next of kin, or his next of kin. You explained withdrawing, which is very elegant from you. He has a problem called meningococcal meningitis or meningitis. Please don't bother yourself by the name. It is a condition in which there is infections or bugs affecting the gathering layers of the brain. I'm sorry to tell you that it is a serious condition, and the seriousness depends on the time of the start of the treatment. The earlier the treatment, the better the outcome. I'm sorry to tell you that, but we are in a critical situation right now. Your husband is admitted in the intensive care unit. His condition is not good despite he started treatment once diagnosis confirmed, and we are giving him the full care. But usually in such cases, with the clinical assessment of his condition, the outcome is not good. I'm really sorry to tell you that, but at some point or at some time, his heart may stop beating or breathing stop. Do you think he left any advanced directive or lasting power of attorney regarding this issue or living will? As I told you, the outcome depends on the time of presentation and start of treatment. These bugs are serious hits if not treated early. Sometimes in very bad cases ends with death. I'm sorry to read that. Other time, patient may live with permanent disability like deafness or blindness or a permanent weakness. I know it is hard for you to hear all this, but I should be honest with you just to know the whole picture and what is our expectation. We hope things will go in the good way. This is regarding your husband. Now, would you tell me what about the who is living with you at home? She's pregnant. She has 3 kids. Any one of them is sick or having fever. Anyone with fever or sick, this child who started to show fever today should immediately be admitted to the hospital to start the first dose of treatment, even third generation cephalosporin, even if not before doing the lumbar puncture, because he has contact history, so he has high risk. Otherwise, those who doesn't show any manifestation of fever or headache or whatever should take prophylaxis. Prophylaxis first line is rifampicin. Rifampicin is safe for pregnancy, safe for children, even children less than 2 years. It is safe for them. والدوز تبقى في الchildren 10 ملغ per kg twice daily for 2 days. The prophylaxis usually twice daily for 2 days. They be should kept at home for these 2 days because they may show the manifestation of the disease to avoid risk to the others. طب بالexam you can give him a report, medical report, so they can do the exam in isolated room or postpone it. Otherwise, about the wearing gloves, I didn't got your point. Wearing gloves, you are talking about the safety precaution if they are dealing with the patient at home, or where I didn't got your point. You were talking about the isolation precautions, صح?
Yeah, I know. We have to keep in isolation, right? If anybody's coming, usually.
Yes. For that, هو المننجوكوكال meningitis infective phase during the sore throat. After this, when they reach meningitis, بيبقى not infective. But anyhow, he is put under isolation, and if she want to see him, بيبقى from behind a glass. The outcome cannot be predicted, but it is guarded. And this for the tracing of the contact. Tracing of the contact بيبقى الهاوسهولد أو الكيسing contact. طب he is working at school. الجوب هنا very important to ask about because you have to notify the school doctor just to be alert if there is any case appear. He should keep in mind that he has a case of or had a case of meningitis in the school. But there is no need for the school contact to take prophylaxis. Prophylaxis للhousehold والkissing contact بس. Clear? First line treatment for meningitis هو third generation cephalosporin or chloramphenicol. I'm talking about meningococcal meningitis. Otherwise, prophylaxis by rifampicin أو ceftriaxone أو ciprofloxacin can be used as well. Okay, this is the average duration of treatment for different type of meningitis, meningococcal, pneumococcal. في meningococcal meningitis بيبقى 5 to 7 days. البروفيلاكسس بيبقى 2 days. Rifampicin taken twice daily. Clear?
Yeah.
Any questions? Thank you, Dr. Kausar.
Thank you so much.
Any questions or comment?
Hello.
Hello,
Dr. Mona. I just want to mention actually in this scenario, will you think about I might be wrong, organ donation?
No, never. No.
Probably not.
He is living. And you never discuss the issue of organ donation with a patient who is still alive. No, never. Never
Okay.
think about even. Mhm.
Okay. Okay.
Can this patient be visited with glove and gown? Better behind the glass. You can use, yes, glove and gowns and face mask, but better behind the glass. Any other questions or comments?
In case if the wife will say that there is an advance directive and he doesn't want to be on the ventilator, in that situation, we really follow that? We have to follow?
Yes, sure. Yes.
Okay.
Okay. Yes, sure.
Dr.
Any other
Mona?
questions?
I wanted to know, in case, like in this scenario, when the mother was saying that she thinks that the child is also feverish and there could be chances that he is also infected.
Yes,
So
should be
do
admitted
we?
and receive the medication.
Okay, all right.
Okay.
The patient, like the if even on suspicion, we admit the patient,
Even on suspicion, yes.
the kid. Okay.
Starting the treatment within the first 2 hours of developing the symptoms make the prognosis totally different. You are talking about 2
Okay.
hours. Mhm.
All right. So, even on suspicion, we'll not do the screening or something. We'll directly admit the patient. Admit the.
You do the lumbar
uh,
puncture, but don't wait for the result. You start the first dose of antibiotic immediately. Then, by the time of the second dose, the lumbar puncture usually will be apparent.
Yeah, but this is for the patient, right? I'm talking about the kid. If the kid, if
Yes.
the kid is suspicious of having, the same
The
goes
kid
for the kid.
started to show fever, and
Yeah.
he has a contact history, right?
Yes.
So he is at risk. So high
Yes.
risk patients suspected, or even if there is high suspicious of meningococcal meningitis specifically, you should
Yes.
start treatment as early as you can, even before you have the result of the investigation.
All right. So treatment will be started for the kid, and prophylaxis is given to those who are all right.
The other kids
Like
and
for
the
the
mother,
mother.
yes.
Yeah.
Yes,
Okay.
even if she is pregnant, it's safe for her.
Yes. Thank you.
Thank you. Any other questions? I'm just going to run over. You have the full presentation on the YouTube. So I'm just raised a time. I thought that you will listen to it, but anyhow, I'm just going to run over it, and you can listen to it by yourself. Why the patient become angry? There is either medical malpractice or complication, and we saw in this different scenarios what is the difference between medical complication and malpractice. I just want to give you an example, very important example, to clarify the difference. A patient with heart problem who is receiving amiodarone for treatment and developed lung fibrosis. Is it a complication or malpractice? What do you think?
Complication.
Complication. It is a complication as long as there is nothing that you don't know about. And the question of how much you know about your condition is very critical. If the patient told you, Dr. Rida, that he went 2 months back to the heart doctor and mentioned about breathlessness, and his doctor didn't examine him or asked for any investigation and wrote him some water pills. And since then, his condition is progressively deteriorating. Do you think it is complication or malpractice?
Small bracket.
Malpractice, صح? Yes. Why? Because lung fibrosis is one of the expected complication of amiodarone. So if you have a complaint of the patient that's suggestive of lung fibrosis, you have to do at least a scan for this problem. But he has been neglected. This is negligence. So what I want to stress on, that there is a hidden part of the story with the patient. So how much you know about your condition is an important part that you have to ask and listen carefully. Don't insist on the idea that you got from reading the scenario alone. Maybe the patient have part of the truth that you don't know, that will be clear when you discuss it with the patient. Again, patient with steroid for skin condition and develop fracture, osteoporotic fracture. This is a side effect. But if the patient was not counseled about the steroid side effects, including osteoporosis, this is a malpractice, negligence. طب how can I know? Everything you counsel your patient about, you write it down in the medical record. So you can return back to the medical record to check if the patient knew or informed about this complication or not. So it is very important to be clear, and this is the importance of counseling and checking understanding in counseling, very important. Malpractice may be due to failure of diagnosis, delayed diagnosis, or misdiagnosis, complication of drug, whether the dose, the duration, the follow-up regimen, or mixing non-compatible drugs, like for example amiodarone and allopurinol and azathioprine. Anesthesia mistake, wrong prescription, wrong treatment, birth injury, surgical error, insufficient staff, improper doctor or nurse, discharging patient who need emergency care, misreading or misinterpreting medical records. These are examples for the different situation that I just mentioned. How to manage angry patient? The first and most important to listen, and listening is one of the skills. Don't never ever interrupt your patient while talking. A scenario for angry patient usually short scenario, so you have to give him his time. You should listen actively. Even your situation while sitting, you should not be very close to the patient because this may increase his anger. Not relaxing on your chair. You should be at the same level of your surrogate and keep eye contact. And you should react by head nodding, by sounds like, oh, yes, I see. This is type of non-verbal communication, or by words. I appreciate your feeling. I know it is hard for you. Anyone in your situation would behave the same way, and so on. Show curiosity to know the details. This gives the impression to the patient that you are really caring. You want to know everything and you are on his side, not against. And it helps to prevent you from defending yourself all the time. Usually avoid being judgmental. In most cases of medical error, malpractice, even complication, you don't know the details. And it is not mentioned in this scenario. And you don't have to be judged. And you don't have to give a solution, but you have to solve the problem that you are in. You are not having the right to judge a colleague or to defend yourself or your colleague, and never assume scenarios from your own mind. And avoid taking things taking things personal. Even if he's angry, even if he start to shout or say bad words, don't take it personal. He is just expressing his anger. You should be honest. You should empathize in a very good way, and this is the most important in communication. Also, empathy, giving time, good listening. To be honest with you, these items very, very important in communication rather than the medical knowledge. Apologize if there is mistake, and give action. What you will do. This in any type of error or any type of angry patient. So starting with medical malpractice, as I mentioned, there is 3A approach. You should acknowledge, admit there is problem, and this problem shouldn't happen, and apologize on behalf of yourself and to the whole medical team, and assure that action taken والactions دي either medically transferred to the ICU, transferred to the emergency department, to the immediately transfused with blood, immediately received whatever according to the situation, and legal action, consultant, informant, incident report written, and a high-risk management team investigating the problem. Remember, any angry patient is unlikely to be receptive or listen to you unless, or your explanation, unless his grief is fully expressed. So don't interrupt the angry patient. Let him finish and react. Don't stay still without reaction, because this may increase his anger. Types of medical malpractice, we mentioned the near miss, which is act against best medical practice, was about to happen but didn't. Medical error happened but no harm, and negligence happened but there is harm. In complication, the approach is different. You should listen positively, which means look to the speaker, have a nice quiet mouth, listen to the patient or surrogate while he is saying, repeat his words and check to make sure the message is correct. Empathize, explain, and put management plan. And we already did scenario for this. So there is no legal acts and no apology. If the patient wants to raise a complaint, whether in malpractice or complication, whether he has the right or not, admit his right, guide to the patient advisory liaison service or PULSE, and assure this will not affect his or her management. He will receive the best care without any discrimination. This was our case today. By this, we finished our meeting today. Thank you for your attention and attending. And if you have any questions.
Thank you, Dr.
شكرا دكتور رضا. Thank you دكاترة. Next time إن شاء الله. Thank you دكتور. Any question, دكتور بركات? You have some question. Please raise them if you have, so all of us get the information.
You answered the question already, Dr.
Okay, perfect.
I'd like to ask about if not informed about the side effect, it was medical error or not. Another question, you answered this question. But another question I was asked in my exam, the patient told me when I asked her, like I asked you in my case, did anyone explain to you the procedure before and you know everything about it? You want me to explain more?
Yes.
She told me that I was dizzy, I was not concentrating, I was not focusing what he said.
Yes, you should in this situation explain in details. Yes.
Yes, I explained again. But the examiner asked me, do you think that she was competent? She told me that she was dizzy. How I can answer this question?
Would you able to rely? Sorry?
In my exam, I escaped. In my exam, I escaped. I told them that I was not present at this time, but it was written that they assisted, that she can understand and retain what they told her. So I assume that she was competent. That I told this examiner. I don't know what is right and what is wrong.
Perfect. Look, doctor. If the patient told you that she was dizzy, you have to clarify. You mean that you got the details of the procedure, its importance, and the drawbacks or the complication of this procedure? Do you want me to repeat it again for you? Because she mentioned that she's dizzy. In our scenario, I mentioned to you, yes, I know. But to be on the safe side, it is important to mention brief, just 3 words. Like any complication, maybe any procedure, it may be complicated by bleeding, pain, or damage, injury to nearby structures. So it is very important if you felt any uncontrollable bleeding, minimal bleeding is accepted. If you felt dizzy after the procedure or this uncontrollable pain, to return back to the medical facility to be on the safe side. Clear? Thank you. Any other questions? I hope it was beneficial for you. Next meeting, inshallah, we'll discuss about functional disorder and dealing with psychosomatic diseases, which is
Dr.
again,
Mona,
yes, doctor.
I had a question
Yes, please.
regarding malpractice and medical error and negligence. I don't understand what is the difference between these three. Like you said that if we don't tell the side effects of some drug, then it is like it's a malpractice. So scenarios in which like patients are given certain medications who interact with each other and there are certain complications and the person is not told about those, then is it like negligence or medical error?
Some interactions are acceptable, some interactions are forbidden. For example, giving
For example, a scenario in which
pyrinol. It is important, or for example, a patient taking trimethoprim.
there had been a trimethoprim
taking cipro
methotrexate.
or clarithromycin or methotrexate. Both of them, this combination is known and forbidden. I can send you a photo for a warning statement from the GMC to use this combination. No, this is negligence because it is warned against. Inshallah, we will make a session for the drug combination, which is considered negligence. Because they are important to know. There are some combination important not to prescribe with each other. For example, anti-epileptic with oral contraceptive, anti-epileptic with oral anticoagulant. في some combination that you have to know.
Okay, so this will be dealt as negligence,
Yes.
like patient having pancytopenia
if
and
there is
having
negligence
bleeding.
or if there is harm. If no harm, it will be medical error.
All right, so any patient who has been like given antibiotic with some delay but no harm was done, then it is medical error. But some antibiotic causing some drug reaction or eruptions as like as a reaction, then will it be negligence?
No, sorry, I didn't got you. Antibiotic and?
Okay. Suppose there are two scenarios. In one in which a patient has been given an antibiotic but with some delay. However, there was no harm to the patient and he or she was recovering. So this is like a medical error.
Yes.
But if there's a person who has been given some antibiotic and he had a reaction to it. So
a reaction is a side effect unless the patient is known to be allergic to this medication.
And
you have to discriminate between side effect, allergy, and idiosyncrasy. Assume a patient is taking penicillin because one of the scenario came like this. Taking penicillin, he is taking it all through his life. He took it before and nothing happened. And there is no reported
allergies
on his medical records. And when he received, she was a female patient. She has postpartum fever, and they prescribed penicillin because it is the only safe medication in the puerperium or during lactation. So they prescribed penicillin. She developed idiosyncratic reaction. Idiosyncratic reaction, unexpected drug effect, unexpected reaction to a drug. She is not known allergic to penicillin. She took it before, no allergy. But unfortunately, this can occur even if the patient is not allergic. This is not negligence.
This is medical error.
No.
Okay,
this is complication of the drug. But you give her penicillin and you know that she is allergic to penicillin, this is negligence. If there is a reaction happen, if no reaction happen, this is medical error. If she is known to be allergic, but if it is idiosyncratic reaction, it is a complication. Am I clear in this point?
Yes, so penicillin, like a patient having taking penicillin for long, and then there was some another drug given, and there was an idiosyncratic reaction.
No, not another drug. Also penicillin.
All right. So
Idiosyncrasy occur in
mhm.
penicillin, known to occur in penicillin in patients who are not allergic to penicillin. He took it many times,
All right.
but this time he
Yeah.
had unexpected reaction and can be
Okay.
fatal.
All right.
But this complication because she's not allergic. But if
Right. So
she is known allergic to penicillin, she has known
yes.
allergy, and you give her, no, it is either medical error or negligence according to the occurrence of harm or not.
According to the
There is harm, there is anaphylaxis or not.
okay. If there's anaphylaxis, then it is
It is
negligence.
negligence. Yes. If there
And
is no, it is medical error.
okay, if there's only like eruptions on the skin and not too much harmful,
Eruption,
then it is
it is complication. Any drug can cause skin eruption.
okay.
But if she's known to be allergic and you give her whatever, it is malpractice. Even it is
Fine.
eruption. You got my point?
Yes, to a certain extent, yes.
So I will emphasize on it again. If the patient is known allergic to, has a known allergy history to certain medication, and you give him this medication, this is malpractice.
This will be negligence.
This is malpractice. If there is no harm,
okay.
No harm,
Okay, got
it is
it, got
medical error. If there is harm, it is negligence.
Okay.
If the patient developed a complication of the drug who is not allergic to, this is a complication. One of the complications of penicillin, idiosyncrasy, unexpected effect of the drug. Yani you do even idiosyncrasy can be can occur even if the patient have done the allergy test was negative, he still can have idiosyncrasy despite doing the allergy test and was negative. It is unexpected. No one can predict it. For the complication, is it now clear?
Yes.
Perfect.
Yes,
Any other
thank you.
question? Thank you.
Dr. Mona, what if the doctor like doesn't ask for allergy, and for the first time the patient has been admitted and penicillin is given, and then there's an allergic reaction?
Should be tested.
He was not known allergic.
If he doesn't have previous experience with penicillin, he should do an allergy test because it is one of the drug known to cause anaphylaxis. So he should check subcutaneous injection of diluted form before giving the full dose. You should do allergy test to penicillin before taking the medication. If it is the first time, you don't start penicillin without doing allergy test. If it is the first time to take it.
Okay.
I wish I made it clear. Any other questions?
Thank you.
Thank you. Thank you all. See you soon, inshallah. I will inform you about the time of the next meeting on the Facebook group. I wish if anyone not on the group, please send a request to add him or her. Thank you.
Thank you so much.